28 weeks in, the remarkable journey continues as the final transformation begins.
As we observe the dramatic movements of this 29-week fetus, we invite you to stay until the end to see the fascinating process of birth preparation. What happens next matters most. As the final weeks approach, the fetus rotates into position for birth. Don't miss the final stages. Follow now.
Subscribe to Food Health 360 for the full 9-month journey.
This animation highlights the crucial breathing practices occurring at week 30. The rhythmic expansion of the lungs is vital for development.
As the brain develops, the smooth surface begins to fold rapidly, creating the distinctive grooves that maximize the cognitive. As the fetus develops, fat layers form under the East Asian fetal skin, reducing transparency in the soft womb lining.
Blinkers. By week 32, the eyelids are fully formed, as we can see here. The rhythmic blinking is a reassuring.
As the immune system develops, maternal antibodies cross the placental barrier, actively protecting the fetus from harm.
The transition from the womb is profound. For the first time, the newborn experiences the full spectrum of light. Here we see the gentle movements of a 33-week-old fetus. The grasp reflex is already present as it holds the umbilical cord. As the fetus develops, the soft cartilage model is gradually replaced by hard bone through a process called.
As the fetus reaches 34 weeks, the protective lanugo begins to shed, drifting gently within the amniotic fluid.
During the REM cycle, characterized by these subtle eye movements, the fetal brain is actively developing and forming crucial connections.
This visualization demonstrates the vital process of fetal swallowing. The amniotic fluid, highlighted here.
The placenta facilitates the crucial exchange, transferring vital nutrients and oxygen from the maternal blood supply across. The 2 arteries and 1 vein carry life-sustaining blood. Notice the strong, steady pulse, ensuring the fetus. At 35 weeks, we see the fully formed fetal fingernails. Notice the ultra-detailed skin folds as the hand slowly moves in the amniotic fluid.
Fetal lung maturation involves the production of surfactant by pneumocytes. This substance reduces the surface tension.
The comparison clearly illustrates the increase in body fat. By week 36, the baby is significantly rounder.
Here we observe the developing grasp reflex. This involuntary action is a key indicator of neurological development during this trimester.
Deep within the womb, the fetus begins to hear the rhythmic sounds of the mother's heartbeat, stimulating vital sensory development.
At 36 weeks, the baby's head begins the process of engagement, settling deep into the pelvis.
Everything looks wonderful, just as it should be.
The developing kidneys begin their rhythmic function early, filtering the blood and producing the urine that is essential for the.
The suckling reflex is a vital, instinctive movement, preparing the fetus for nourishment and development outside the womb.
With limited room, the baby stretches its limbs, a sign of healthy development in these final weeks.
The delicate, translucent skin begins to thicken as subcutaneous fat deposits accumulate, resulting in a smoother, more opaque appearance. The period between week 28 and 40 sees the most dramatic changes. The skin thickens and the organs mature. As the uterus expands during pregnancy, it presses upward against the diaphragm, restricting the space available for the lung. Between week 28 and 38, the expectant mother undergoes significant changes as the fetus grows rapidly in preparation for birth.
As you can see, the vascular expansion leads to a significant increase in blood volume, ultimately reaching its peak in the 3rd trimester.
As the baby descends, the pelvic pressure increases. Notice how the fetal head engages with the pelvic inlet. The added weight of pregnancy shifts the center of gravity, causing the lower spine to curve forward excessively. These are Braxton Hicks contractions, often called practice contractions. The uterus gently tightens and then relaxes.
When the cardiac load increases, the heart muscle has to work much harder to pump blood effectively.
Pregnancy insomnia is often caused by a melatonin shift. Our animation illustrates how elevated hormone levels. When the skin stretches rapidly, The collagen and elastin fibers in the dermis rupture. This internal tearing leads to the dangers.
As the fetus grows to week 35, the uterus expands, placing noticeable pressure on the internal structures.
Edema is caused by fluid accumulation in the interstitial spaces. As you can see here, excess fluid causes swelling.
As your pregnancy progresses, the baby's movements become stronger, a reassuring sign of their growth and well-being.
Rib pain due to uterus expansion.
As hormone levels change, they interfere with neurotransmitter release. This disruption can cause the emotional centers of the brain to become overstimulated.
As birth approaches, the hormone relaxin causes the ligaments supporting the pelvis to soften, a process essential for delivery.
A balanced diet is crucial in the final trimester. Focus on lean proteins like salmon for fetal development. Ensuring adequate iron intake is crucial. Excellent sources include leafy greens like spinach, lean red meat, and beans.
To support healthy fetal development, focus on calcium-rich foods.
DHA and choline are essential nutrients found in foods like salmon and eggs. They play a critical role in the development and function of the human brain.
The water distribution within the body is vital. As we observe in this middle-aged South Asian woman, to alleviate discomfort in the third trimester, perform these gentle pelvic tilts. Start in a tabletop position. The pelvic floor muscles, including the pubococcus and iliococcus, contract and lift, improving vital circulation and support.
The optimal position for both mother and baby is sleeping on the left side. Using a full-body pillow provides essential support for a restful night.
Severe edema is a critical warning sign of preeclampsia. When complications arise, an emergency C-section.
If you experience sharp abdominal pain or frequent uterine contractions, it could be a warning sign that requires immediate medical attention.
This animation compares normal fetal activity with a concerning lack of movement. If you notice a sudden decrease in the first stage of labor is divided into phases. Early labor sees dilation up to 3 centimeters, progressing rapidly. The amniotic sac, filled with protective fluid, typically ruptures at full term. This is commonly known as your water breaking.
In this sagittal view, we see the fetal head crowning, the widest diameter presenting. Following expulsion, the head.
Follow Food Health 360 for the entire pregnancy journey.